Dr. Munjal, I imagine many hospitals in India are still getting over the devastating second wave of COVID. How are hospitals preparing for this next wave?
Yeah, it's a mixture of a lot of anxiety as well as a part of the preparation, the drill, which is bringing back the vivo memories of all that happened not so long ago. After having passed through various festivals, much better like Diwali and then New Year's celebrations, suddenly we are faced with this amazing and haunting prospect of Omicron striking us in a big way. And as we know, we are getting hit as fast as anybody else in the world due to this. And the rate at which it is spreading in terms of hours and days is alarming.
Are officials preparing for a worse wave than the previous one that India saw in April and May last year, given the fast spread of Omicron this time?
Absolutely. The secondary transmission rate, as we all know, of this virus spreading is much higher than even the alpha and the delta variants. So be sure that we will start seeing cases not in terms of thousands now. We will start seeing cases in millions in the days to come. And we have to brace us all up for that. Hopefully, as we have been told, and we are seeing in the initial first peak, the disease is not showing that disastrous kind of symptoms, the lung symptoms especially, which requires oxygen as support. And therefore, we are a little bit, you can say, a little bit more easy with the whole situation at this moment of time. But we all know that if the disease prevalence crosses 1%, at that time, even if the variant is mild, it's going to start straining the healthcare system enormously.
And do you think there'll be a more coordinated effort to tackle the wave nationally, or are state governments largely operating on their own again with differing rules depending on where one lives?
No, this time we are already seeing a much better coordinated response from all authorities, including the state and central governments. Notwithstanding, of course, the elections that are happening, the National Assembly elections are due in 2024, and also we have various state elections like Uttar Pradesh, Punjab, and some peripheral states. Because of that, due to the political campaigning, the healthcare does take a hit because we want massive rallies through political parties and things like that. That is going to definitely dampen the morale of healthcare workers, as we can see. But be rest assured, the agencies otherwise are well oiled, and we've already started issue much better coordinated alert systems in the state and in the country. And the municipal corporations, the state government are much better with the hospitals are much better at coordinating this time.
And
that we can see very well.
what are the concerns as case numbers surge? Are there enough testing kits, hospital beds? Last time we saw a massive shortage in oxygen tanks.
Well, that's a worry. Whatever you might say, with a massive 1.4 billion population in the country, a virus, if it spreads like wildfire, it can never be enough for the normal state or country's healthcare system to take in all. And that is a real concern. We want to slow down the virus. And that is why for a country like India, it is so much important that people follow the basic rule of the mask and also stop overcrowding at places. And this is the only way by which we can slow down the virus. We are not afraid of the virus. We can believe that it's a much milder variant. But if it strikes at a percentage where we have 10 million people coming in positive in a single day or something like that, the wickets are going to fall and the healthcare system is going to crumble again. So that is a real worry.
And where is India at with its COVID vaccination program? How much of a difference will it make to hospitalizations, do you think?
Well, vaccination in India is an example for the world to see. It's a fantastic and a very successful program so far as now is concerned. The first vaccination was prompted mainly by the Delta infection that struck so many people, and there were queues for vaccination all over the country. And therefore we could achieve more than 1 million vaccinations in a day at many places, and over 10 million people, rather, I would say 1 billion people could get vaccinated for the first dose. Whereas for the second one, the response was a little bit more muted. People got a little bit complacent. The total number of vaccinations in India combined now stand at around 1.4 billion doses. And of course, we need more. We need the second vaccine so importantly for everybody to fill in the spectrum of immunity. But at the same time, we are looking at kids' age group. We are looking at the third booster dose, which is going to definitely be strained because of the lack of second vaccination drive in people, and also with the fact that we are being struck currently by the Omicron.
And just finally, to what extent will the curfews help, and would you expect further restrictions in the coming weeks?
I guess we have to basically, we know all that the secondary transmission rate is high, so it's going to spread all around. But the thing is, if we could slow the peak from here to, we can just flatten it a little bit and make it slower, that will be the real success story for India. And if we can come out mild, as countries like Australia and UK and all have done, we will be much better off in terms of tackling. And hopefully we'll not fill the ICUs, and we'll not have those trolleys and ambulances, the horrific scenes at crematorium grounds that we saw in the second wave. I'm shuddering to think about that as a healthcare worker, as an ordinary citizen of the country, and never like that to happen again.